at WCCO, we want to keep you as informed as possible about COVID-19. We've been FaceTiming with doctors to get your questions answered. Tonight, I talked with Dr. Katie Eichten. She is an emergency physician at Hayward Area Memorial Hospital in western Wisconsin. To start with, I asked her how her hospital is preparing for more cases.
I think the situation is our communities are getting ready. We know that it is in rural Wisconsin, it is in rural Minnesota. Because of the time lag it takes to get testing and the decrease in the amount of testing, we don't know quite how much there is. So we are protecting ourselves like it is in the community, and we are also preparing for surge numbers as well.
Talk about social distancing in rural communities. Is it perhaps even more important where there may not be the medical resources that we have in the metro areas?
Absolutely. Social distancing is by far our biggest thing that we can do in small towns. And I think our town is doing a good job of that. In Northwest Wisconsin, if you look at the cell phone data, people are staying home. And that makes me proud of our communities that they're listening to that. And they know that that is the best thing we can do to help us be able to respond and provide everyone the care that they are going to need.
Give us your opinion here on how Wisconsin is handling the health crisis overall. We know that there are more cases in Wisconsin than Minnesota. Perhaps that comes down to more of a testing issue than anything else. But do you believe that Governor Evers' Safer at Home order is really helping hospitals where you are?
I do. I think that we are saving lives by staying home. I think that it is slowing it enough that it's giving our hospitals time to prepare and time to gather resources, as this is not something that we do every day.
And doctor, I'm not sure what you can say on this, but are you able to give us any numbers as to COVID-19 patients where you are or the hospitals you work? Are you able to share anything about that?
I think the numbers don't tell the full story. We have a limited amount of tests. There is a significant lag time in some of the testing. So when we see any person with any respiratory symptoms or any symptoms that could be COVID, we have to treat them as if they have it. So we don't know for sure who we're treating, who actually has it and who doesn't. But we are taking full precautions and protecting the hospital staff and trying to protect the community as best we can.
And what about the ICU situation where you are? Are there any COVID-19 patients in the ICU at the hospitals where you work?
So we do not have ICUs. So most small rural hospitals do not have intensive care units. We do not have COVID ICU patients. However, we understand that if surge numbers require it, we are planning for what that would look like for us. We have incredibly competent family physicians, nurses, nurse practitioners, staff, and we're trained in rural care. So we can do a broad spectrum of care. And so we are preparing for what it would look like for us to have some ICU patients in case that's what's needed.
Just getting to some of these viewer questions, Doctor. First off, Angie Johnson asked a question I think perhaps maybe you hear the most of, but in your opinion, when will this end, she's wondering.
I don't think it's going to end for a while. I think hopefully we can get through our peak, and the different models shows that that could be in 3 weeks up to 6 weeks.
And this is something we touched on a little bit earlier, but Tony is wondering how many cases your team has encountered so far.
Again, that's hard to know because of the delay in the testing. So, and again, sick people we're transferring at this point. You know, if you are looking like you're going to need ICU care, we will be transferring. But at the time that we transfer them, we don't know if they have COVID or not.
Larry is wondering, if you recover from the virus, are you immune from contracting it again?
That's a great question. Good news is that Mayo will be starting its antibody test hopefully tomorrow, and then we'll know if you've had it and if you have antibodies. What we're hoping is that the people that have antibodies are protected and that those are the people that can get back to work.
Randy Williams says he's wondering, when did this actually start? Is it possible that some had it in January, February? We just didn't know much about it at the time. And that's something we've heard from too. People think, gosh, these symptoms sound just like something I had a few months ago. Is it possible that this really has been circulating for longer?
I don't know the answer to that. I think it probably did spread similarly to what they're showing and what we're seeing with the test results. It was probably here, at least a couple weeks before we had our first positive test, but I think that's too hard to know for sure.
Colleen Dorsey says, what does an inconclusive test result mean? Is it like a false negative? And what should doctors and their patients do about that kind of test result?
I think the main thing to think about with the test results is if it says you're positive, it really means that you have COVID. If it means you're negative, you could still have it. So the test actually misses about 30 to 40% of the positive tests. So just because it's negative or inconclusive, you might still have it. So that's really the messaging, is that if you have any symptoms, you have to stay home. You have to self-quarantine, because even if you have a negative test, you could still have it.
Good reminder, yeah. Mike is wondering, is there any data or evidence as to why some people are asymptomatic?
Well, it seems that the people that are asymptomatic, so they don't have any symptoms at all, tend to be the younger people. And so unfortunately, I think that caused people to make some poor choices about social distancing. And when you look at the more recent data in Minnesota and Wisconsin, it's a large proportion of younger people that are hospitalized.
So do you have questions about COVID-19? Let us find the answers. You can send any questions you may have to the email address you see there on your screen.